Well, good morning, everyone, or good afternoon. My name is Lauren Letellier. I am the Director of Communications and Community Engagement here at HCA Florida North Florida Hospital. Welcome to Ask a Doc. It's Colorectal Cancer Awareness Month here in March, and so we're so excited to have some very distinguished guests with us today to talk more about this extremely important topic. So joining us today, we have Drs. Tony Brar, and then we have Dr. Ryan Heath, who's new to Ask a Doc. Welcome.
Thank you. Absolutely. Glad to be here.
Really
Thanks
excited to have you. Really awesome. And we got a veteran here, so he's going to help us lead the way. So thank you guys so much for joining us. We love doing these community education videos. So we want to go ahead and start it off today before we get into our topic by asking everybody to let us know how our sound is. Let us know if you have any problems. We're watching our feed now. And then also, we're watching the feed the whole time. Go ahead and submit your questions at any point during the broadcast. I'm watching them right here. The doctors are here live to answer your questions here on Ask a Doc. So don't hold on to those questions. Go ahead and put them in the live feed. We'd love to answer them here live on Ask a Doc today. Also, tell us where you're watching from. We like to see where everybody's watching from. We have some really, some viewers who watch from all over the country sometimes, and that's really exciting to see. So go ahead and say hi to us and let us know where you're watching from today. So we'll go ahead and get started. So Dr. Brar, tell us, and Dr. Heath, tell us a little bit more about both of yourselves, and so we can get to know you a little bit better.
Sure. Maybe do you want to go ahead and start?
Sure, yeah. Ryan Heath, one of the GI doctors here at North Florida, hail from Arkansas originally, go Razorbacks. Did my residency, basic medicine training at University of Arkansas in Little Rock. Actually did my fellowship training at University of Missouri, so now I'm here in Gainesville, collecting SDC teams everywhere.
I was about to say, how's that going?
Not as well as I would like. But I did live in Kansas City before I came here, so go Chiefs.
Yeah,
Thank God for
go Taylor
Sunday.
Swift, go Chiefs.
Go Taylor Swift, absolutely. But here I do general gastroenterology, colon cancer, I admit, is a particular interest of mine. I have family members, friends, grandmother in particular. Love you, Meemaw. Thanks for tuning in today. But have struggled and fought that fight with colon cancer successfully, thank goodness. But something I'm passionate about, and happy to be here with you guys hanging out, taking questions, talking about it.
Awesome, Dr. Heath. That's fantastic to have you on Ask a Doc. Welcome.
Yeah.
All right, Dr. Brar, go ahead and introduce yourself.
Yeah, sure. So thank you so much for having me as well. Tony Brar, I'm from Florida originally, kind of different from Arkansas, I guess.
A little bit.
You know, I did my training at the Florida State University, FSU College of Medicine for med school, and then did my essentially residency fellowship here in Gainesville at the University of Florida, and then spent an extra year kind of doing interventional advanced endoscopy over in Orlando for a year, and now have been here in North Florida kind of practicing. And I'm also, similar to Dr. Heath, we're excited about this topic. I think it's super important, very valuable, and very excited to kind of help raise awareness with what's going on this month.
Tell us about Colon Cancer Awareness Month and why it's important that everyone should know, you know, what should we do this month, you know, what's this month important about, and tell us a little bit more about that.
Sure. Yeah, Colon Cancer Awareness Month began back in March of 2000. Goal is really just to raise awareness that there are a variety of different screening options out there, including the colonoscopy that no one gets excited about, although I think it's an important tool, a very useful tool to help screen for it. Goal really just to inspire people to start getting checked. You know, recent change, you know, we used to recommend average risk persons start getting screened at age 50. You know, now we say 45 is the new 50. We are seeing colon cancer on the rise, unfortunately, more and more so in younger people, and we've lowered the screening age for that reason.
Wow.
Yeah.
That's kind of the scary thing that's come out, right, for us, some of us in that generation, in that pool. So we'll talk a little bit more about that later, so stay tuned. Dr. Brar, tell us a little bit more about what is the colon and what does it do? Can you kind of break that down for us?
Sure. So the colon is basically an organ within your digestive system. It kind of sits lower abdomen, and it functions to basically help reabsorb water and kind of break down and excrete bodily waste, as you can imagine. And you know, the importance of checking it, like we kind of mentioned, is the risk of it, you know, developing any sort of precancerous lesions or anything that may develop into cancer. And the goal is to kind of prevent that from happening. And so that's why, as we kind of mentioned already, stressing that emphasis of starting early and often and hoping to prevent anything, you know, from progressing.
So let's, the significance of colon cancer, right? This is in our daily conversations. We see it in the news all the time. What are some statistics that you can share as to why this type of cancer has become so prevalent and significant?
Sure. So it's common, real common, truthfully. Chances are, you know, more than one person that's experienced this, suffered with this. Whether you realize it or not, it's about 1 in 23 men will develop colon cancer, about 1 in 25 women. Wow. More than 300 colon cancer cases diagnosed a day, over about 150,000 a year. So very, very common, more common than I realized when I started doing this. You know, unfortunately, is the second leading cause of death in the U.S. About 140 people die daily. And as we were mentioning, we are seeing rates increasing, doubling really, in patients under the age of 50. So common problem, although something we're thankfully equipped to help screen and deal with.
Yeah, and I really want to emphasize the earlier age thing, because even nowadays you see a lot of celebrities or social media in the news about someone younger and younger, unfortunately, either being diagnosed with the cancer or unfortunately even passing away from the cancer. And I think if we, you know, as healthcare providers are able to educate the general public on the importance of screening to prevent this from developing, I think that will really help, you know, limit and hopefully decrease these numbers that we're seeing.
Yeah.
Okay. What are some of the risk factors that people can look out for in regards to colon cancer?
You know, the biggest thing, I think a lot of it is genetics, and there are definitely different genetic syndromes that can predispose you. Things that we have control over, things that we would say are modifiable. Diet can be a big part of it. Eating a lot of highly processed foods can definitely contribute. Smoking, alcohol definitely can contribute. We do know that obesity can be a risk factor as well. Certainly, other important thing we'd always want to know when we were talking to you about screening is, do you have a family history of colon cancer? That in particular would absolutely put you at increased risk. And again, you know, age greater than 45, as we were saying, because 45 is the new 50.
Yeah, and kind of hitting home on that topic of your family history is very important, because not only having colon cancer in the family, but also other certain genetic syndromes can predispose people to it as well. Or even a family history of kind of advanced kind of polyp or precancerous lesion can also put you at higher risk, which we'll probably touch on later, I'm sure.
Okay. So tell us a little bit more about how we screen for colon cancer. There's several options, right? There's that gold standard that we talk about all the time, the colonoscopy, right? But there are other options too that we'd like the public to know about. So tell us a little bit about all of those options.
Sure. You know, there are a few different ways we can go about doing it. One, there is the different stool test out there. Cologuard, probably the one I see most commonly, although there are a couple. Essentially looking for DNA, different things in the stool that can suggest a colon cancer, or at least higher risk for colon cancer is present. There's the CT colonography, also called the virtual colonoscopy. Essentially kind of going through a CT scanner. Does still involve some prep, but a little less invasive than using the camera. And then, of course, there's the traditional colonoscopy, looking directly with the camera like we do it every day. Not as bad as people expect it to be, although I'm aware no one gets excited about it.
Sure, absolutely.
Yeah, and just kind of emphasizing that, I think there's multiple kind of modalities and testing options, and I think, you know, each option may be different for each person. So I think just at least getting the awareness that you do need to be screened. Everybody in the world needs to be screened for this, and how you go about it maybe not as important as just getting it done. So I think if you want something less invasive, going with one of the kind of stool testings options is, you know, very reasonable, depending on if, you know, you're not high risk or other reasons not to just do that stool testing. But a colonoscopy, as we'll talk about, you know, it's not a surgery, it's a procedure, very routine, very safe, commonly performed and done, and you know, has ability to do real time, you know, prevent things from progressing and remove precancerous lesions and so forth.
You know, we had Dana McCurdy, our complex GI colorectal cancer nurse navigator, on last week, and so I thought she made a good point as well. With all of these different options that are available, really, end all be all, you're going to have to get a colonoscopy if something were to come up in those other tests. Is that correct?
That'd be correct. I'd say any abnormality in the stool test and the virtual colonoscopy would ultimately we recommend proceeding with the colonoscopy. It does have the advantage, as you were mentioning, if we see a polyp or see something that looks abnormal, can remove a polyp or take a piece of that tissue, look at it under the microscope, get a better idea of what exactly is going on.
Okay. So before we move on in our presentation today, I just want to thank everybody who's watching. Thank you so much for tuning in. This is Ask a Doc here at HCA Florida North Florida Hospital, and today we're talking about Colorectal Cancer Awareness Month. And so we have Drs. Tony Brar and Dr. Ryan Heath here, and they're going to be answering all your questions here live on Ask a Doc here very shortly. So go ahead and put those questions in the comments. We've got some great comments so far. So Kevin says, great to see these bright young docs taking care of us in the future. All right. Thanks for watching, Kevin. That's great.
Thanks for watching.
So we'll go ahead and finish our presentation, and we'll take your questions here shortly. So go ahead and put those in the comments. So docs, tell us a little about how often should people get screened? What would you recommend?
Sure. So colonoscopy is normal. We have great bowel prep, see everything we need to. Don't find anything abnormal. 10 years generally is what we say. In the case of family history, would recommend a little shorter, probably about every 5 years. If you do have polyps, something we're able to take out and take a look at, we would want you to likely do it a little sooner, depending on how big they are, how many there are, how it looks underneath the microscope.
Yeah, and kind of stressing the importance that, it's not just a one and done. Typically we kind of recommend, the standard average risk person anywhere from the ages of 45 to 75. Obviously, some variability with each person specific, but you will need some form of multiple kind of assessments to make sure nothing develops in the future. So it's not just you're good now, doesn't mean that something can't happen later. So it's kind of stressing the importance to be on top of it and taking care of your preventative health.
Right. And then always staying in tune with your body, right? So even though, you may not be due for your screening right then, what should people be looking out for, if they need to go see a doctor? What are some of the signs that they should
absolutely.
be looking out for?
And that's a very great point that you bring up. So we're talking a lot about right now screening and someone who's healthy, has no issues, that everyone needs to get done. Mm-hmm. But absolutely, if you're having any sort of unintentional weight loss, any sort of rectal bleeding, abdominal pain, any symptoms out of the ordinary, you should definitely seek medical advice from your healthcare provider to see if you need a further workup. And as gastroenterologists, we see this a lot of referrals, and patients come to us for these symptoms, and that involves us to do maybe a further workup than just a colonoscopy. You may need something further involved.
Okay, absolutely. That's great to know. So how would someone develop colon cancer? Can you talk about the term polyp, and what does that mean when people hear that?
Sure, yeah. A polyp is really just anything that looks abnormal to us on the camera when we're doing the colonoscopy. Not all polyps are precancerous. It is why we like to take them off, look underneath the microscope. We want to make sure that you're doing a colonoscopy as often as you need to, not necessarily more often than you have to. Most cancers do begin as smaller polyps, though. Kind of looks like a mole, a wart in the colon. Something that can be removed pretty easily. Generally, they take about 10 years to develop from polyp into full-blown cancer, although some people, they can grow or develop faster depending on genetics, other things going on. That's the good news, though, is catching them early, catching them at that small phase, we can prevent colon cancer.
Yeah, I think I agree totally with that. I think the biggest thing is the preventative measure with these things, because majority of us probably do have polyps that are probably precancerous. But if we get the appropriate screening, we do the colonoscopy, which is a routine outpatient procedure, we can go ahead and remove these lesions and prevent them from developing or causing issues down the line, which is really the goal of what we want to do when we do these screening colonoscopies for our patients.
Absolutely. So, docs, tell us about when someone's diagnosed with colon cancer. What happens then, right? What's the next steps? What's the treatment plan?
So if we unfortunately do find something like colon cancer, you would end up meeting a lot of other doctors and nurses. Truthfully, medicine is a team sport, and there are other doctors, nurses that specialize in surgery, if that's what needs to happen to remove it. See our cancer doctors, talk about things like chemotherapy, our radiation oncologist team. if radiation is indicated. Certainly doing more scans, figuring out is that colon cancer in one place, has it spread elsewhere. A big group of people, all there for a good cause, all there to ultimately get you over that hump, help you fight that battle. But definitely involves a large group of people. I see us as kind of the front line, the greeters at the door. And I always hope that that's as far as it goes, but we're ready for you. If we find something scary, you can certainly continue that process on.
Yeah, and I kind of want to echo that and emphasize the biggest thing is knowing that, you know, you're not alone.
Oh, yeah.
Because this can be so overwhelming.
Totally overwhelming, and we totally get that. And we want everyone to know that, you know, if something like colon cancer is diagnosed, the first step is to realize that you have a support system in place. Dr. Heath mentioned, you know, a large team in place, and the good thing here at North Florida, we meet weekly. We have a tumor board with all of our physicians, providers, those who are involved in cancer care that really discuss patient cases and come up with the best treatment plan using different kind of evidence-based therapy. And sometimes in addition to standard surgical resection or chemotherapy or radiation, we have different ongoing kind of clinical and research trials to help maybe develop some new modalities of treatment that may be options for certain patients. So I think the key is just, you know, realizing that there's support for you, you're not alone, and getting plugged in within your healthcare and provider to help set that up is really important.
And I love that when you said like it was a team sport. It's it's, you know, everybody's looking out on your care, and I just think that's just a fantastic thing for patients to know. You're not alone. What is your for both of you? What is your take-home point for Colon Cancer Awareness Month that you want the public to know today?
Oh man, you know, I think prevention is key, as we've mentioned several times. Absolutely, in many cases, colon cancer is preventable if caught early. I think the other important part of that is recognizing that we are seeing an increased rate in colon cancer in younger people. It is important to get that screening started early as well.
Yeah.
Do you have anything to add?
Yeah, no, I agree completely. I mean, my biggest thing, I think, in addition to this being Colon Cancer Awareness Month, you know, you might see blue everywhere, and raising the awareness.
Yeah, good job, guys. Sorry,
Yeah,
I let everybody down today. I apologize.
No,
I was on point last week. I promise.
But yeah, raising the awareness that, you know, everybody out there needs to get screened for this. It's totally something that can be preventable with the appropriate screening, and that, you know, the shift to the younger aged patient population is extremely important, because even though you're young, you feel healthy, you still need the screening to get done to try and prevent any problems from arising in the future. And I think, you know, nowadays there's just, as we mentioned, there's so many different ways to get screened that, you know, there's options for you, and we can cater, you know, towards patient specific with what needs to be done to get that done. And then even, you know, with colonoscopy being kind of the gold standard and most commonly kind of performed procedure, I want people to know it's very easy. I think people may think of it as more difficult or scary or a surgery, and it really is not that at all. It's very minimally invasive. Some people even view it as a quick, you know, 30-minute nap.
It's true.
So for some people, it might be even refreshing.
That's a good way to market it.
Yeah.
From the marketing director.
So that's, that's really what I want people to take home from today's kind of message.
Absolutely. Well, thank you both so much. I think we're ready for questions, guys. So go ahead and put your questions in the comment of the live feed. I'm watching for them right now. We have Dr. Ryan Heath and Dr. Tony Brar. They're advanced gastroenterologists here at HCA Florida North Florida Hospital, and we're here to take your questions. So go ahead and put them in the comments of the live feed right now. I do see a question that's popped up here for you guys. So you were talking about polyps earlier. My doctor just told me I had a polyp. Should I be scared? So what do you guys think?
I'd say generally no. I'd say thank goodness that we know that you have one, and now we can start that process of taking it out. I don't know if this person's had it removed already or something in the process of occurring. But again, I see that as good news. We know we can address it and take care of it. Okay. Even kind of thinking more broadly along that line of, you know, what might we find, I always say, hey, you know, if God forbid we find something scary, sooner we know about it, sooner we can do something about it. And if not, even better, we can all rest easy.
Okay, great. They had a follow-up question, actually, just as we were talking. Perfect. So they said, you know, what's going to happen with that polyp? Are they going to cut it out, biopsy it? Like, what should they expect?
Yeah, good question. So typically, whenever we do the colonoscopy, the goal is really to find these colon polyps. And not all polyps are cancerous or even precancerous. Some of them are benign. But we only truly know that once we resect it, remove it, and send it off to our pathology to really examine it under a microscope. But there's some features when you look at it to see that makes it higher risk than other polyps, given size, vascular nature, the blood vessels, sometimes the location. And then, you know, like you mentioned, what do we do about it? We obviously would want to biopsy it, and nowadays there's different types of resection techniques that may even avoid the need for surgery. If it's a larger polyp or maybe minimally invading in the colon, sometimes it can be removed still through colonoscopy, and you still may avoid a full surgery depending on the size of it.
Yeah, absolutely.
Okay, great. Well, thank you so much for your question. I really appreciate everybody watching today. Thank you so much. This is the last call for questions, everybody. We're running out of time here today. We had some fantastic content for you, and this will live on our Facebook page forever for you to watch over again and again if you need that. So, and if there's any questions that are coming across the feed that I'm not seeing, if you want to put in a question later tonight when you're watching this, well, go ahead and send them to Dr. Heath and Dr. Brar as well so they can answer them for you. So last call for questions. Go ahead and put them in the live feed right now. I do see a question that's just popped up about bowel prep. They told me that I have to take all this bowel prep. You know, they're like, oh gosh, do I have to do all of it? You know, so what would you guys say?
Bowel prep's definitely the least fun part of the procedure. No one gets excited about where the camera goes, but you're asleep for that part. Doing the bowel prep, you'll earn the nap. I will say it's better than it used to be. You'll hear horror stories about the old gallon of salty, chalky stuff. We used to have you chug down as fast as possible. We have different stuff now. It's less volume, it tastes better. It is still a long night in the bathroom, although thank goodness we live in the age of smartphones, YouTube. You're not reading the back of the shampoo bottle all night, unless you want to, because you'll be there. But again, you'll earn the nap. We'll keep you a real comfortable day of.
That's great.
It's worth it. I got 3 small kids. I'm looking forward to that nap.
Yeah, absolutely. Well, you recently did a video on bowel prep that we're going to be giving to our patients, and there were some tips on that to make your bowel prep more successful that you gave. Can you give those as well?
Yeah, thanks for bringing that up. Yeah, so we actually will have a video that kind of goes over, and again, anytime you get these procedures scheduled, you get all the information on the bowel prep, and like Dr. Heath mentioned, you know, I think people sometimes think it to be worse than it actually is. Most of the times I tell patients that it's, you know, the most maybe worrisome or anxious part of the procedure, but once you get through that, it's like Dr. Heath mentioned, a nice nap. So, I want to stress the importance of it, because without an adequate bowel prep, we're not able to successfully do our job in order to visualize and do our screening to find these polyps. So it's kind of a shared decision making with patients to try and make sure that we both do our part to try and do what's best for everybody. And so I think, you know, taking the prep as the directions kind of state, following the appropriate diet the day before, avoiding certain medications that might, you know, limit it, avoiding certain foods that might limit it, are all important. And, you know, be sure to check out our video on the bowel prep to go into further details on that.
Thrilling video, I must say. One of the best videos I ever made. So, but the end all be all, the thing is, drink all the prep. Very important. Very important. Well, I think that's all the time we have for today. I just wanted to give it to both of you guys to tell us, why is Colon Cancer Awareness Month important to you?
Yeah. Well, first of all, thanks for having us. Happy to be here. I'm happy to raise awareness on this really important topic. I think as gastroenterologists, this is probably what we do the majority of our time with regards to some of our procedures and what we educate patients with and a lot of the referrals we get. And so I think, again, just stressing how this is prevalent, it's very common, and it's something that can be prevented. So raising awareness that, one, everyone can get screened for this, and that we can prevent the progression or possibility of cancer in itself should hopefully excite everyone to, hey, let me go get this done, let me get my health checked. And I think stressing that point is really important to me personally.
Yeah.
Absolutely. Dr. Heath?
No, I absolutely echo that. I think it's great. Yeah, again, as I mentioned, I have family history. I'm one of those people that is at increased risk of colon cancer, and anytime you think about any kind of cancer, that causes a lot of anxiety. I think it's important just to talk about colonoscopies and ways for screening the way we have. Really just that, one, that it works, but two, it's not nearly as bad as you'll hear either.
Yeah.
It's great. It's
just
a great
mark your
nap.
calendars every
It's
March.
effective.
Yeah.
Absolutely.
or whatever time frame that is applicable to you. On your phone.
Absolutely.
Thank you both so much for your time, for taking the time to do this community education. We appreciate it greatly. So thank you very much for doing this.
Thank you for having us.
Thanks so much.
Thank you so much.
Absolutely.
Happy to do it.
Absolutely. And thank you all for watching another episode of Ask a Doc. We hope you'll tune in for another episode here soon.